My name is Dr. Megan Leach. I'm the Medical Director and Principal GP here at HearMed Healthcare. Anybody is a good candidate for a hearing test. It's so important to have a baseline of your hearing as you age and as you go on in life, because you won't know what you've lost and won't have a baseline to refer back to. We would recommend screening your hearing from the 5th decade, so from about your 50s onwards. And you could get that done part of a routine screening as you would a general checkup at your GP, kind of every 2 to 5 years. 3 years would be ideal. And I'd say even more often then if you've got any risk factors like diabetes or hypertension, or if you've any family history or personal history of hearing loss. Hearing is one of your most vital senses. We're always so careful to be minding our eyes, going for eye screening and retinal screening, especially if you're a diabetic. But so few people think of checking on their ears and their hearing. Your hearing is extremely important with communication and in terms of just keeping you cognitively sharp. If we're not hearing well, you're going to need to rely on your other senses to pick up the cues that you're missing. You're going to become over-reliant on lip reading, and you may miss really important information. So the most common symptoms of a hearing loss are really hearing it from your family. We so often will get families coming in, bringing in a loved one saying, listen, they have selective hearing. But it's more than that. It's missing details in a crowdy restaurant, not being able to follow and track the conversation, having to turn the TV up to the point that it annoys those loved ones around you. And when the cat starts scurrying away because the TV is too loud. It might be something like not being able to really track and keep up in a crowded space. Yeah, those are definitely some of the signs. It is so beneficial catching hearing loss early because there's so much that can be done for early hearing loss. The sooner we restore hearing, the sooner we're able to rehabilitate the vestibular and sensory neural hearing system. And so we see better outcomes with patients. They tend to preserve the hearing. They're able to preserve their cognitive ability as well. So that will keep you sharp later in your years. So some of the myths that we hear people complaining of when they come through the doors, things like, I become reliant on the hearing aid. You can't become reliant on a hearing aid. Hearing aid is going to improve your hearing, and it's going to preserve your hearing, and it's going to help rehabilitate the system. So it's not going to cause a dependency there. We also hear from patients that they're big, bulky and ugly, but hearing aids have come such a long way and they're so discreet. And I think what we would often say to patients is somebody's sooner able to pick up that you're unable to hear with the constant what, than they are to notice a tiny hearing aid in the ear.